First, we still do not have any reported confirmed Ebola virus disease case as of 1st of June. We have a total of suspected Ebola virus disease samples that have been tested, which is 22 as at this morning, and all of them have turned negative. At the ports of entry, we will deploy measures because as we have already been working with authorities from different other countries to ensure that we have exit surveillance, we also are going to demand to ensure that there's screening from the country of origin before getting into our country, and everybody must produce evidence that they have been screened from the 10 countries that we are already screening at our ports of entry. It is important to note that our risk communication, we are going to up it to ensure that the members of public and the communities know exactly what they need to do. As at now, we want to encourage members of public to ensure that there are high levels of hygiene. And should you feel unwell, do not run to the chemist to buy medication. Please ensure you run to the nearest health facility for further assessment. We have our laboratories that are ready for testing. We have the National Public Health Laboratory. We have the KEMRI, Nairobi, KEMRI, Kisumu. We have a mobile lab in Busia. It is good to note that we have assessed the ports of entry and the readiness at the ports of entry, and we will continue deploying other. We will continue deploying the healthcare workers at the ports of entry so that we can build on the capacity that is there. As at today, in the last 24 hours, we have been able to screen 13,548, and cumulatively, we have been able to screen more than 66,000 travelers. The country has also been mapped. We have mapped a surge capacity of 118 healthcare workers that are on standby, and we equally have a felt-tip team that has been trained in the country of 90 healthcare workers. We also have other healthcare workers that have really been trained lately, about 70 of them. So we have capacity in case of a surge that we may deploy the healthcare workers. We will continue training and also sensitizing the healthcare workers. As at now, we have been able to sensitize more than 1,000 healthcare workers on issues, detection and also case management of any suspected cases. Equally, there are those counties that have been mapped out as either very high risk, others are high risk. The very high risk counties include Nairobi, Mombasa, Uasin Gishu, Busia, Kisumu, Bungoma, Nzoia, Siaya, West Pokot, Turkana, Homabay and Migori. The high risk equally are Vihiga, Kakamega, Nakuru, Kericho, Nandi, Kiambu, Machakos, Kilifi, Makueni, Taita Taveta, Isiolo, Elgeyo Marakwet, and Garissa.